And I'm going to address another question, and I refer back to my district in the Rio Grande Valley, but obviously there's many places around the country that are similar. The Rio Grande Valley, with over 98% of its population identifying as Hispanic or Latino, is also faced with almost double the rate of uninsured as the rest of the state of Texas, home to double the uninsured rate of the country. With less access to health care, South Texans are also faced with higher incidence of chronic conditions such as adult and adolescent diabetes and obesity. These conditions and health care costs associated with them exacerbate health and financial burdens placed on South Texans, impacting our wallets, health, and opportunities. Professor Currie, would you speak to the complex relationship between income, race, and health disparities and how we saw these interrelated factors impact communities during this COVID-19 pandemic? My district, for example, is actually the Rio Grande is 4% of the state population, but we represent more than double of the mortality rates because of COVID around the state. So we represented, I think, almost 10% of the deaths in Texas. Could you talk about that?
Yeah, another thing I guess that hasn't come up very much is immigration and responses to immigration. And one of the things that we saw in the years leading up to the pandemic was a lot of people who were eligible for health insurance but didn't use health insurance because they were afraid that it might have immigration consequences. So, for example, immigrant parents with U.S. citizen children and the U.S. citizen children not being enrolled in Medicaid because the parents were afraid that that might lead to immigration problems. So, that's an important issue. Another important issue, which hasn't gotten very much attention and is true in Texas, Texas saw a big decline in Medicaid enrollments among children after 2016, which seemed to be largely due to administrative barriers to people signing up. There was no change in the income limit, but it was just made more difficult. And those kinds of barriers really matter to the administration of programs and resulted in a lot more people being uninsured.
Thank you. Yes, and at the height of COVID in my district, our hospitals were at full capacity. People were dying outside of the hospitals in ambulances. They became virtual hospital rooms, if you will. We had 4 freezer trucks in the Rio Grande Valley. As you can imagine, with collecting cadavers, it took us 20 or 30 days to have a decent funeral. But at the height of it, we had a shortage of even oxygen, not only PPE and everything. And what could we do with international vendors that were distributing oxygen to hospitals around the country? But it seemed like our region was the last to receive the just essential necessary items as oxygen, PPE, equipment for our local physicians and healthcare providers. And I didn't see that disparity in other parts. I called friends in Houston and Dallas and other parts of the state, and they were also going through a very complicated time. But it seemed like regions like ours were at the end of at the back of the bus and were ignored. And certainly rules need to be put in place to assure that never happens again.
Well, COVID really laid bare the sort of lack of emergency preparedness for something like that, right? So I think across the country, public health units have been understaffed, underfunded, so people know what needs to be done, but they don't have the resources to do it. Unless we do something about that, that's going to happen again the next time that we have something like COVID-19 come along.
I think especially
Gentleman's time has expired.
Thank you.